Hello and welcome. My name is Darlene Jenkins and I will serve as your host for today's webinar titled Starting with a Strong Foundation, Council Resources for Training Your Staff in HCH Core Competencies. This webinar is a production of the National Healthcare for the Homeless Council with support from Health Resources and Services Administration, Office of Special Population Health. The webinar is scheduled to be a 1-hour presentation with the last 10 minutes reserved for questions and answers. Now, I will introduce our presenters. Our first presenter is Greg Morse. Greg graduated from Western Michigan University Physician Assistant Program in 1994 and has worked at Peak Vista Homeless Health Center since 1997. Greg was instrumental in expanding the services at Peak Vista by initiating an urban outreach with backpack services in 1998, mobile van services in 1999, and expanded the rural outreach segment in 2009. Since 2004, Greg has served as the program director at Peak Vista. In 2002, Greg received the National Humanitarian Physician Assistant of the Year Award for sleeping on the streets to access homeless services. He has served on the Council's Clinicians Network Steering Committee since 2008 and is the immediate past chair. In 2011, Greg became the founder and executive director of Ascending to Health Respite Care, Inc. in Colorado Springs, Colorado. Our second presenter is Victoria Raschke. Victoria is the Director of Technical Assistance and Training for the Council. She has a master's degree in English from the University of Tennessee and is a trained chef. Her professional background is in adult education, curriculum development, and standardized testing evaluation. Victoria has taught and designed curricula for literature and composition, business management, nutrition, and menu design for culinary professionals for traditional classroom settings as well as online learning and training environments. With those introductions, I will now turn the webinar over to our first presenter, Greg Morse.
And thank you, Darlene, for that wonderful introduction. I'd really like to give a shout out to the National Healthcare for the Homeless Council for providing this webinar on core competencies, and hopefully we can get you an idea of how to develop some of these core competencies as part of a program within your project in developing a competent workforce. I was thrilled to be part of this project as I feel that we have progressed from what I consider an independent healthcare providing entities over the years to what is now a cohesive group of dedicated professionals involving a distinct type of specialty care. And we have arrived at the point in which we are now ready to establish, I think, a foundation for developing a quality workforce and an entry-level standard in which all disciplines of homeless service providers may look for guidance when orientating new employees. And to do so with an orientation tool that will hopefully increase the ability to perform successfully in their new roles. This webinar will provide an overview of the work that has been accomplished to this point, and we will encourage, hopefully we won't have to demand, feedback to the Council and this work group, ensuring the final product is reflective of the needs of all those requesting such a tool for implementation in their projects. So this is the living Hades in which we provide care to the homeless. I mean, we provide health care, we do our outreach here, and we lend a smile when we have to. But I think the main point of this is that even in a setting like this, you experience homelessness. Core competence. I think this is a decent, concise definition of what competence is, and especially as it relates to those of us providing homeless services on a daily basis. It was a good starting point, and I think a great foundation for starting our dialogue as a work group in trying to define what competence is in the homeless arena. And just to kind of go over this, competence is a multifaceted and dynamic concept that is more than knowledge. It includes the understanding of knowledge, clinical skills, interpersonal skills, problem solving, clinical judgment, and technical skills. I think that pretty much sums it all up. Why core competence? It was initially determined in direct feedback from the Clinicians Network 2010 Needs Assessment as a high priority issue. We are looking at this because I think it's needed for workforce development, streamlining patient care, and having the ability to disseminate to offset intrinsic differences present in HCH healthcare delivery. It kind of defines what is expected within our specialty and to hopefully build a better patient-centered and special population-focused delivery of care. To kind of sum this up, there was a real big drive, especially from administrators and projects across the country, wanted to utilize a tool or a reference in the orientation of new employees, especially those new into the homeless healthcare arena, giving the new employee an idea of what basic competencies are expected of them and to obtain these competencies to help them succeed in their daily jobs. Target audience. Target audience is clinicians, those new to the HCH setting, sometimes even seasoned ones to kind of just get re-centered as far as the work that they do every day as a guide to what is expected to perform high-quality care to homeless individuals. Administrators as an effective tool in establishing a standard of care for their projects. Basically anyone involved in integration of services to maintain a constant standard of care across disciplines. So literally it is everyone that has a hand in providing healthcare services to the homeless community, especially for the first time. It gives them an idea of the skills needed to enter the HCH workforce, but with special attention to administrators or management wanting the ability to assess future performance via a basic core competency standard that we think can be established across projects. Here's what we know. What we know is that homeless patients or clients face barriers in seeking healthcare services. Clinicians providing care to homeless patients also face barriers in assuring access to quality care. And developing treatment plans, individualistic treatment plans, often require care teams with interprofessional input from disciplines usually not privy to HCH core competencies. This was kind of the focus of our endeavor, our work group, because the homeless population can be a very complex population, and favorable outcomes in your interaction with homeless clients can be based on possession of, or at least the understanding of, what makes a successful engagement or encounter. We have taken the attributes and concepts we know to be successful in homeless engagements from a broad range of homeless service providers to make the final list of 12 competencies. So what have we done to date? What we've done is organize a work group to develop and define the final product. The team consists of Clinicians Network Steering Committee members, Clinician Network members at large, and a multitude of professional disciplines with tremendous support from the National Healthcare from the Homeless Council staff. What we did is utilize monthly calls extracting ideas and information from each of the major players in this work group and defined numerous key elements of what competency looks like in the HCH setting, or what basic competencies. There were numerous key elements that we had a overwhelming task of trying to narrow down to a workable group. And then we discussed forms of delivery and dissemination. And again, I'd really like to give a shout out to the National Healthcare for the Homeless Council, steering committee members of the Clinicians Network, and Clinicians Network members at large, including a huge contingency from King County in Washington, yay go Seattle, and their input from their project. We actually then narrowed down as a work group the key elements to 12 core competencies, felt to be the basics needed to enter the field of HCH care. Each narrative includes a description of what the core competency should require, and actually, as we place it onto the website, there are links off of each core competency to other resources that help boost and support the narratives for those key elements. So you can go in and you can play and you can get different ideas and tap into different resources to kind of get an overall picture of what each key element entails. And then the base core competencies are now currently being formatted and proofread for consistency. Go on here. The 12 core competencies taken from that huge bucket of key elements that we kind of threw into the fray to try to narrow down. And so here we go. What we come up with is the basic 12 that we think are crucial to the basic core competency in providing care to the homeless. Key element number 1. This is more of getting onto the National Healthcare for the Homeless Council's website and tapping into HCH 101. It's a self-paced course there. And it is actually a phenomenal course that kind of starts from the beginnings of the National Healthcare for the Homeless Council and its genesis and how it's evolved over the years and how care and outreach has evolved as well. And they have input from videos of caregivers and perspective from clients and little exercises and tasks in there to evaluate yourself and how to take care of yourself to kind of ward off burnout. And we felt that this, as far as the first key element, was a good step to get an overview and what to look for specifically in the subsequent key elements. I kind of threw this slide in because when you're in an encounter or an engagement with a homeless individual, that a lot of times there are things hanging in the balance that are not really visible. Things that may influence how the encounter continues from a homeless perspective. That sometimes they may have different priorities at that given moment. They may be dealing with complex comorbidities, transportation issues if you try to come up with a treatment plan and they wonder how they can get to the next step. Just something to kind of keep in mind. Key elements number 2. Sorry, I'm trying to find key elements number 2. High priority clinical issues. This in itself, anyone entering into the healthcare for the homeless field really needs to have a working understanding of complex diagnoses and that they exist in the homeless community, knowledge of emerging and urgent clinical issues, how housing and healthcare are intertwined, the fact that we have extensive efforts in adapting clinical guidelines to homeless practice in an effort to enhance the ability to provide quality care. And in general, to kind of keep up to date with health news in the HCH field. So those new to the setting just need this basic knowledge and to kind of keep it in the back of their head while they're performing outreach or whatever their jobs may entail. Key elements number 3. Managing substance abuse, mental health disorders, cognitive impairments. Just basically you need an understanding that these factors are prevalent in the population and provide challenges to care, that patients are often duly diagnosed with these, that each can have an effect on their health, obtaining employment, transitioning into housing, and treatment adherence. You must be able to, especially with these lying in the background, be able to coordinate services that can help transitioning, hopefully, out of homelessness, and when to bring in or find resources for substance abuse counselors or mental health counselors, and to utilize evidence-based engagement models for some of these things like motivational interviewing. Key elements number 4, providing trauma-informed care. The person new to the providing care to the homeless really needs to understand that many have experienced trauma and continue to do so throughout their homelessness. Homelessness is often associated with child abuse, intimate partner violence, traumatic brain injury, and military service. You really must have the skills to understand patient behavior, try to provide impartial care, and develop individual treatment plans, based on their life in homelessness, basically. A good thing to kind of bring out of this as far as trauma-informed care are the core principles of trauma-informed culture. And those include safety, trustworthiness, choice, collaboration, empowerment, and all of these from a client's perspective. They need to really feel safe and comfortable with you. They need to be able to trust you, that they have a choice in how their treatment will progress, that they can collaborate with you and have the power to guide how the ship will go, basically. Key elements number 5. Managing complex multimorbidities. Be aware of this. It is becoming a really great issue within the homeless population. Homeless patients have a multitude of chronic health issues, mental health issues, substance abuse, alcohol, and are often found in the same patient. You really must have the skills to handle these multiple morbidity issues while coordinating care and services to optimize good health outcomes. This coincides actually with a greater work group within the Clinicians Network Steering Committee that is really trying to streamline identifying patients with complex multimorbidities, how to track clinical outcomes, and make a positive intervention. Key elements number 6. Developing treatment plans. Many HCH projects lack sufficient staff, finances, services to develop treatment plans that can meet high-level needs of the homeless patient. Most have working knowledge of what resources, you really must have a working knowledge of what resources are available and use them to your benefit, and adapt treatment plans to best provide services needed. Patient-centered medical home, learn it, love it, live it. This really is an art and is often dependent on the collaboration and resources available to your project. That's the key part from this, and being able to utilize this. But it can have a profound effect if you can master the skill set in client clinical outcomes. Key element number 7, managing medications. This is actually probably a poorly titled key element at this point. And if anything comes out of this, if you can really just kind of help with how to more properly label this key element, because the true issue is not the fact that we want somebody coming into the HCH field to manage medications, but it is really, it's having the ability to see the client's presentation during your encounter. And at any given time, realize that it's not necessarily a specific mood or mental health-based issue that that has the person presenting at that time or driving their disposition. That there can be medicines often used in the homeless population that can affect that mood, that a sudden non-compliance with medications can have a profound effect on the homeless individual's disposition, and that really importantly, just don't assume, be cognizant of these other influencing factors, that it's something else and not specifically mental illness. Key elements number 8, conducting outreach and engaging clients. I think we all know that homeless persons are the most disenfranchised members of society, detached and often distrustful. Outreach is a skill necessary for clinicians engaging homeless patients, encouraging follow-up, and to facilitate the referral process. I'd like to think that at times anybody doing outreach can potentially be the point man in breaking down barriers for that homeless person that they are engaged with at the time. Your ability to perform an effective outreach can mean the difference in a homeless person accessing health care, housing, substance abuse, or mental health services, and it really just lays the foundation for everything else that we do. This is a great picture that effective outreach can have a great impact on individuals on the streets. I kind of threw this picture in there. This is the target of what we do. This picture, I mean, it kind of holds an emotional aspect for me, because I truly believe this picture was taken about 4 or 5 years ago, and I think at least 3 of the 4 are now deceased at this point. I'm actually really not sure about the 4th one, but effective outreach, engagement, and mobilization into services, I think, can help prevent these bad outcomes. Key elements number 9. Performing motivational interviewing. I think I had mentioned that before in one of the other key elements, and it's part of the overview. But this is kind of the cornerstone to the homeless provider interaction. It needs to be a fairly refined skill in people entering the homeless healthcare field, whether providing direct clinical services, performing outreach, or counseling substance abuse or counseling for substance abuse or mental health. This is a basic skill that optimizes the chances of a homeless person taking an active role in their own treatment plan and possibly changing their behavior that could have led to homelessness. Kind of go over some of the key components. It's a semi-directive approach. It's patient-centered and focused. Motivational interviewing is a skill that helps the homeless patient provide a relationship with focus on developing goals for themselves regarding health care, fosters dialogue that hopefully will result in patient-driven treatment plans. It also increases the awareness that possibly their risks, their behavior risks hold consequences. Key elements number 9, care coordination. I think that this was a difficult one. It's an important part of our interactions with transitioning homeless clients into services, and especially out of healthcare for the homeless setting. It's more of an art than anything else. It has components of, you really need to be able to listen well, to negotiate, the ability to advocate for those providers outside to those providers outside the HCH network on behalf of the client, and hopefully will optimize a sound, feasible, and attainable treatment plan for clients in keeping with healthcare standards. It is more of a concept. It's being able to keep an eye on the overall care of the homeless person, and especially as they transcend into areas of specialty care or those that don't directly provide homeless services on a daily basis. You really need to be able to advocate that that a homeless person at times deserves the same standards of care that their housed or insured counterparts do, whether those services are in healthcare, mental health, or agencies providing ancillary support for clients. Next, we have key elements number 11, practicing self-care. You do a great job of providing services to the homeless population, but a lot of times we neglect ourselves. This is a very difficult population to provide care for emotionally for you as a provider. Burnout is very common among clinicians. You must know when to take time and eliminate stress, access support, and you can also promote staff well-being in addition to your own. Sometimes you could be the last to know that you are approaching burnout. Burnout it has very high rates for those with any longevity in the homeless field of healthcare. It is important to just step back, relax, and focus. Implementation of this key element in your project can be crucial in maintaining a high-functioning workforce at all times. This is my happy place. It is mine alone, and you need to find your own. I need to be able to take care of myself here and not worried about if you're taking care of yourself. So find your place in which you can actually relax and get refocused. And the final key element is mentoring coworkers. The ability to put into practice a mentoring program for new persons entering the healthcare for the homeless arena is important for easing them into what can be an overwhelming learning curve for new employees. It can go a long way in sustaining a quality workforce, and it can also be a means of maintaining proficiencies for those seasoned employees, those with a lot of candles on their employment birthday cake, and lower the risk of burnout. So, what's next? What's next is that we need to finish the formatting and the content, evaluation for consistency, which we're heading there. We've placed it as a link off of the National Healthcare for the Homeless website. I'd really like to apply a tab, a catchy little phrase, if you will, called HELP, Homeless Entry-Level Proficiencies. It is available now, and it's in place. It has its prudent links, or at least we're developing the prudent links pertaining to each key element. Remember, this is a living document. Get in, play around, access the links. Give us your feedback on the format, how easy it is to access those resources, how informative it is to you. The purpose is to make sure that we have a sound product that every project can use in their orientation process, and rest assured it is consistent across all projects. And then hopefully as we get and progress to more of a fine-tuned product, we can develop it as develop a kind of pre and post test so that you can gauge what your knowledge was going into these core competencies and what it is coming out. And I really wanted to touch on how important it is, or it can be from an administrative standpoint. Part of the orientation, it can be part of your orientation process for new employees. It can provide reinforcement for those already in the HCH care, those seasoned employees, to kind of get back up to speed, so to speak. It can provide familiarity for administrators maybe not having been in the HCH for the homeless field before and maybe don't have direct homeless care, contact. Hopefully with your feedback we can make this a standardized assessment tool that you can use in your orientation process and make it available to disseminate the information on the culture of homeless care and to those that offer ancillary support for homeless clients. And that is my presentation. I will now at this point turn the microphone over to Victoria Raschke, and I hope you enjoyed it.
Thank you, Greg. I'd like to start my first slide. Really, Greg has done a great job of telling you about what the content of the guide is, and I'm going to kind of give you an overview of how to use the guide and where it is on our website. So my first slide is a screenshot of our homepage, lots of green, and in that menu you see pretty clearly the kind of second half of the page. So under resources, under clinical resources, tools and support, and then staff training, and that'll take you directly to the page there without a link if you just get to our website. The guide is really set up as a lot of resources that we have in one place. So you can see here, just from these little snapshots of the drop-down menus, that we have a lot of resources on the website. And I'd like to let people know and remind people who've heard us say this before, if you have trouble finding something on the website, we do have the search feature at the top, but it's pretty deep and broad, and we're always here to help you find something on the website. Don't hesitate to call or email us, and I'll give you that information at the end of my slides. So the next slide here is a screenshot of the guide itself at the table of contents, and this is the direct link, kind of a long link, so that easy way to get to it through the menu there. So the first item, as Greg mentioned, is the HCH 101, and that is a great place to start. And Greg pointed out this touches on a lot of the key elements through the rest of the core competencies. And each section has a description that was developed or is being developed by the core competency work group, and learning objectives for that section that are pretty broad and able to cover really the idea of that section, not the individual resources. And then a list of resources with links if they're available on the web. Some of the resources are off-web sources, books, or things like that, and we try to give you enough information to order that if you needed to get it. The other sections after HCH 101, like I said, HCH 101 is a great place to start with new employees, whatever their background is. And then the other sections are good for refreshers, maybe for, as Greg said, more seasoned HCH providers, or to further training on some of those aspects touched on in HCH 101. There are continuing education credits available for a lot of these resources. We partner with the Vanderbilt School of Medicine here in Nashville for our continuing education credits, and those are CMEs, which is the medical doctor or doctor of osteopathy continuing education credit unit. They are transferable to a lot of other disciplines in the healthcare field, including alcohol abuse and substance abuse counselors. So just check with your local credentialing body about that. And if you have any questions, please let us know. The continuing education credits available are also at no cost, which can be very helpful if you have employees who need to take some classes or things online to continue their licensure. And again, if you have any questions, please don't hesitate to call us about that. So Greg has mentioned some of the pieces that we're still working on with the guide. The pre and post test, as I said, kind of like the learning objectives themselves, will be broad enough that whatever resource you choose to use in the training, several of these core competency pieces have, sometimes up to 10 different resources. You might not use all those in a training. So the post-test and the pre and post-test is designed to be broad enough that you can use any of those resources with it. We're also going to include internal bookmarks. Right now it's a very long document, all 12 of those core competencies on one page. So we're working on some navigation tools to help use that a little more easily. We're also continuing to add resources and learning objectives for each subject. I have updates to make today already just from our internal review with staff. And then finally, the most important thing is, as Greg said, this is a living document. It's definitely open for comment right now. We'd like to hear from you or other members of your staff about what is useful, what could be more useful, what resources do you need beyond these, even down to how it's formatted and what would be useful for you. So please let us know about that, and we'd like to help make it the most useful tool for you possible. And finally, as Greg said, and I've already touched on, the guide is really designed to funnel a lot of the best resources for training that we have available on our website into one easy place to help administrators with staff training or even people who want to look at it for self-training purposes. But we have a lot of resources available, and we have a lot of people available as resources. So I wanted to take an opportunity to remind you that at any time on these subjects, on other subjects related to program requirements or any other type of technical assistance and training, you can always call us. My email address is there, and Julie Hashida, who is our technical assistance coordinator, that's her email address, and we'll be happy to help in any range of that. Our technical assistance and training really ranges from us giving you an answer to an email or a phone call as quickly as we can, or pointing you in the right direction for resources and information, up to video and teleconferencing for technical assistance or training, or up to on-site visits and on-site training. So please don't hesitate to use this. There's also a form on the website that you can get to under the technical assistance and training menu that you can request technical assistance or training in a form there online, but you can call us too. I'm going to turn it over to Darlene for Q&A, and we'll go from there. Thank you.
Thank you, Greg and Victoria. I will begin now the Q&A session. If you have a question, please type it in the chat box under the presentation slide on your screen. Our first question is for Victoria, and it asks, how or where can I give feedback for any possible changes or additions to the key elements developed in the guide?
Great. You can email me directly, and there's a link on that page to my email address right from the web, or you can call our offices and they'll send you to me, or possibly Darlene if she's here and I'm not. But we'll be happy to talk to you about it or reply to your email and take that information and make the guide better. I'll also include a link with the link to the page and a way to contact us in the follow-up email once we archive the webinar too, so you'll get it directly in your email as well.
Okay, thank you, Victoria. We have a question for Greg. It says, can anyone still join the Core Competency work group, or has that dissolved?
You are hired. I was actually going to bring that up if I did get a question, is that, yeah, we can take all comers into the work group. We and would really appreciate feedback at this point, especially after this presentation, and with a focus on fine-tuning it, and especially with administrators out there that would like to have any direct input as implementing this as an administration tool. So we meet, I think it's the third Tuesday of the month. I think you could probably send your email link into the council and get you on the distribution list. So we would welcome that, absolutely.
Thank you, Greg. Well, if there are no other questions, I would like to thank both of our presenters as this concludes the Q&A portion of the webinar. A full listing of upcoming council webinars and other educational products are available on our website at www.nhchc.org. We'd like to thank you for joining this webinar on Core Competency produced by the National Healthcare for the Homeless Council and this meeting is now closed.